Welcome to the Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this third episode of our CAHPS survey series, we're talking about turning insights into impact. Dr. Rhiannon Winsor is joined again by Kimberly Gonzalez and Sam Reinhard to explore how feedback from the CAHPS survey can be used to optimize provider and staff behavior without blame or burnout. From actionable tweaks in clinical communication to shifting patient perceptions through small, meaningful moments, this episode is all about practical strategies to improve the patient experience from the inside out. If your team is getting CAHPS data but not doing much with it, this is your sign to start listening, learning, and leading better.
Okay, so we are back in the exam room with Kimberly Gonzalez and Sam Reinhard, and we're continuing our conversation about the CAHPS survey. And in this episode, we're focusing on optimizing provider and staff behavior based on insights that we can capture from the CAHPS survey. So first question for you. The CAHPS highlights domains where our performance is unsatisfactory, right? So how can we use insights from these low scoring areas to influence providers and staff behavior and ultimately improve the patient experience?
You got to put it in front of them. For a long time, people weren't necessarily showing people the results because we were afraid of hurting their feelings. Because we know we all show up to work and we work as hard as we can and we're all trying to do the best we can. Right. And no one's trying to negate that. But if you don't see what the perception is, you can never actually improve it. I think even when we talk and someone's like, you say a lot. Only until someone tells you that are you ever going to be aware of the fact that you're saying a lot.
Yep, that's
right?
True.
I still say it. This is real. You're welcome. It still happens. However, every time it happens, I'm like, ooh, there I went. So if a patient says they're curt, let's just say, then every time you're curt, you're going to figure out, oh, I was curt. And so maybe then only when you can recognize it could you actually change it. And so if we don't put it out there in front of people, then they're never going to make any change. And so instead of hiding it from teams and just trying to make process shifts, and they just think it's a process shift, but it's really a process shift driven by feedback, you have to get it in front of them. And so I think that's the most meaningful, even though sometimes we live in a world of keyboard warriors. So sometimes they are not nice, but you got to know what's not nice. And say, this is just the opinion of one. However, the opinion. Take it for what it is.
Yeah, and I think that's one of the key parts that falls on administration or management is kind of telling the provider, we're not trying to defend the score. This isn't a negative reflection on you. This is just something that is happening, and it's the experience of our patients. And what does this tell us? And that then becomes a coachable moment where you can talk to your clinical team and say, okay, well, what can we do about it? And it's not necessarily, you have to make sure that you hit that hard, because it is sometimes on these CAHPS scores, you'll see high performing areas and you'll see low performing areas. And really you just need to track, okay, where am I moving the needle and where can I do that? And sometimes it's small actions, and that in itself is the conversation you need to have is, don't take this personal, but here is what's being told by us, and this is why it's important that we care about it. And I think also that really helps when they're aware of the scores, because then when changes do happen, you know the reason why and why it's impactful and why you should care about it. And those then, help have the conversations. Okay, well, how do we improve the daily interactions we're having with our patients or whenever we see them come around? And they're a little bit more aware because they know where that came from and what the motivation behind that was.
And we've really taken an approach of trying to share positives, because opportunity always lies in the negative, right? That just is what it is, plain and simple, right? But we also can learn from where our patients think we do really well. So making sure we share those for not just one to see. We try to share every positive comment as well, not like, I like them, but if something a little more meaningful. Not that that's not great, and we all like to know that, but when people are thinking a certain way and you really wowed them or you really made them feel cared for, it's important to share those so that we're not just being like, this is where we need to improve, because we know we need to improve in places, but we also need to know that we do really well. We knock it out of the park a lot of times. But when did we miss it? You got to share both. I think that that's more meaningful for staff. And so I think whenever we look at our improvements, of course, where can we is important, but where did we do really well is also really important to share.
Yes. Working in higher education for years, we kind of learned that giving student feedback, right? It's like the compliment sandwich. You know, you start out with, you did this really good, and this is where you're excelling. This is where we can improve, but this was also really awesome, you know, so you're giving them, so I love what you said about talking about the positives. So to reinforce, catch them when they're doing something right, and then, talk about as a group how you can improve. I like that.
And I think it's also really important with leading with the good is because you want to see that continue over the years. You don't ever want to see somebody shift their focus to the negative and low performing areas, and then suddenly you see a slight decline next year on those good performing areas. You don't want to lose that momentum because it is so hard to make those point adjustments year by year. And so you want to make sure that they're aware of what they're doing well so they can continue doing it and building upon it. And I think that also provides a cushion for further years is if you're doing something really well and there are sometimes ways to improve that where you can still even do more. That then just helps you improve your overall score. And so you might not always be able to fix the low performing areas, but if you continue working at the high performing areas, that'll still cushion it and you'll get that positive point adjustment. And at the end of the day, you'll have highly motivated individuals to continue doing that work.
Absolutely. So those are all great examples kind of leading into what I wanted to talk about next about small changes in staff communication that can kind of move the needle as far as patient satisfaction, patient engagement. But any other thoughts about small changes in staff communication specifically?
So for us, one we've really been trying to tackle, of course, because it always seems, I think there's this adage about healthcare taking forever, right? So you're just fighting, just in general, it takes forever, even though sometimes it doesn't. And lots of times it doesn't. Yeah. But everyone just thinks it does. Yeah. You're going to dedicate your whole day to it. So you're competing with something that's just built in, right? You have no control over it. Of course, we have a technology to try to help us communicate with the patient without us having to communicate with the patient that talks about their wait time. So it's a visual cue because we're pretty visual people most of the time, right? But then the other piece of it became visual for our team members so that does stuff on a screen so that they have a cue to remember to check in with the patient. It doesn't change when the provider is going to be in that room because sometimes those things are outside of anyone's control. But it's still checking in with the patient. We didn't forget you. They'll be right in. Can I get you anything? Those small changes really shift the perspective of they didn't just leave me sitting in here for 2 hours, right? Because this is not common, at least in the old adage of healthcare. Now we're doing so many things, really trying to close gaps, and there's always someone checking in because everyone's trying to do these other pieces that are not necessarily what you came in for, but since you're here, right, there's a whole bunch of extra check boxes we're trying to check. Yeah. So people are constantly coming in and out, but there's visual cues you could put in to remind yourself to check in with that patient so that it gives a different perception. And you're not just sitting there twiddling your thumbs, playing on your phone for hours, right? Sometimes I'm like, I wanted to play on my phone longer. I never get, right? I have kids. I want to sit here and scroll and no one talks to me for 20 minutes. I want to wait a little extra, right?
Unless you're in one of those little flimsy paper gowns.
Yeah. However, I think sometimes we move a little quicker, but because people are coming to check in. But that's good at the end of the day for these surveys, right? And so it's trying to think of ways you could create less alone time that are simple.
And unfortunately for our health centers, I think a lot of the times you're fighting against private practice and what a patient's perception is of what the ideal healthcare experience is. And so a lot of the times visual cues like that help. Sometimes even having reminders around the office of here's what to do if you need it. Did you know this is available for you? And just having those flyers around, little cues like that the patient can take away while they're looking around. I know one thing we've played around with Tony and with you, Rhiannon, was, are there promo videos we can have going on where we're educating the patient and just having them immersed in the experience while they wait? Because at the end of the day, we have them there, might as well make that time useful. And by doing that, the patient sometimes does feel it might be a 10-minute wait, but they're so immersed in the promo or whatever they're doing that they don't really feel that. And ultimately, what they feel is what we're going to get reported on. And so that's, I think, one opportunity there that lies, that sometimes the waiting room, that's a time that you have them, make it useful and meaningful for both the health center and the patient.
So it seems like that there was fantastic communication about communication between staff and patients, but what about between staffs themselves? Is there things that little small changes, tweaks we can make?
Yeah, I'm sure most of us are probably doing huddles, right, within your teams, and they do them daily. So that's generally where a lot of that happens, which is nice. I think for us, a real improvement is leaning in on technologies where before you would maybe try to use your phones to get a hold of someone or something, where Microsoft, so using Teams has been very helpful. So you can get stuff done a lot quicker, right? Because you'll message someone and you can very easily see like, oh, they're not going to see that. So then you're not leaving this patient waiting. You can say, I put in this order, they're going to give you a call back. So sometimes although it's not even verbal, it's, what's happening with this other person. So then it's a lot easier to give the right message to the patient instead of delaying something for them. I think we're way more plugged in and you have a lot more technologies instead of, I said I've worked there 14 years. I could go down an extension list just trying to get a hold of someone before. Now, you still might do that. And if they don't answer, you'll say, hey, are you available? Well, they have their computer in that exam room, so they can say no or yes, or I'm on the phone with the patient. What's up? Knowing who's part of your care team is important, and knowing when your friend's reaching out to you, they probably need something urgent, right? Because there's a patient somewhere. Using your tools for what they are is really important. I think those huddles have become more and more, like we put a lot more pressure on them because that's the best time to really give updates for things that have happened within the center. And so that way you're in constant communication instead of waiting till next week's staff meeting. If there's a real issue, you just push it out through those huddles. And so you have extra avenues that are really small, quick things that aren't a million ways of stacking stuff up and they don't walk away with the right message.
Right.
And I think there's little things. I mean, one of the key things is knowing that there is a team behind the provider, and it's not just the provider themselves. I've even seen it in a lot of our FQHC's EHRs where they're able to leave little notes for the provider and saying, this patient is high risk for this. They just had an ER. Little notes like that make it easier for the provider, that when they go into that room to see the patient, they already have that front of mind and they can ask about it. And that proactiveness and just checking in with the patient makes the experience better for them, because then they say, okay, well, it wasn't, they're thinking about my ER visit. How did they even know about my ER visit? That's already, something that goes beyond those four walls. And that's data that we have available and can, supply to the care teams. And that's just, like Sam said, having that communication within your team and making sure that comes up during the daily huddles or any outreach opportunities that you do have.
Excellent. One last question for you as we're wrapping up this episode on optimizing provider and staff behavior. In one sentence, if you can, what's one small action a provider can take today to improve patient communication or patient experience?
I think just tying it back to the good old question is, do you have any questions? Do you feel you've understood? Allow that opportunity for the patient to feel comfortable, like they can ask those questions. Or the teach back method where you say, okay, well, this is what we reviewed today. Can you just kind of repeat it back to me? And then in that moment, you'll see, did the patient really understand me? Was there any flaws that were experienced during our visit? If so, I might not be able to answer it. My MA can do an after hours call if it needs something more lengthier and there's no time provided. Things like that, just that simple end question before you leave that room, gives the patient opportunity to speak for themselves.
I think that too, and I think the provider drives a lot. So whatever they say is what's carried. And so saying things like my care team will be in touch, letting them know that there is this other team of people behind them that's going to help them, and say they will be in touch if that's the case with their follow-up. The other thing I think we're really trying to drive, and it's really provider driven, is if you come, do you have any other questions today? Generally, I think we're all guilty. We all think of them after we've done something, right? And you're like, oh my God, I have 20 more. If you have any additional questions, don't hesitate to ask them through the patient portal, because you got to give them that avenue. And if the provider's saying, ask me those questions, then they're more willing to ask those questions. Only through that are you able to provide quality care, because you don't know what you don't know. And it's really tough from the provider's perspective to answer all of your questions that are stuck in your head. So I think it gives the opportunity for the provider to be like, oh, you need to talk to clinical pharmacy or whatever through the questions. And so maybe their course of treatment will have shifted, but the provider drives that conversation.
Yeah, good point. I think for me, from the patient perspective, if the provider is seeming really rushed, like that communicates something to me that's like has a negative connotation. Like, okay, come on, I got to get through, you know, I left you in the exam room for 25 minutes, but now I'm here and I got 5 minutes. I know they have to see so many patients a day and there's all these other factors, but is there something they can do there?
I think going back to what Sam said, it's realistic. Sometimes providers do have to see a plethora of patients in a day, and sometimes it's not feasible for them to have those extra 5 minutes to stay there and answer questions. But that's when it's good to know that you have a team behind you and that there's different avenues to reach the provider, even if it's not directly in person. And sometimes it's just a simple thing of having the MA assist the patient in enrolling in the patient portal, and here's how you leverage it this way. Or maybe they don't like that, and we have a hotline where you can reach the nurse line directly and ask those questions, and eventually it'll tie back to your provider. But letting them know that there's options available, because the patient ultimately does want to feel involved in their treatment plan and know that they have that avenue to their provider. And so there's always creative ways to get around that, and it's just accepting that it is the reality sometimes of providers, is that they're just that burdened with the time schedule.
I think the difficulty, because I of course see it on the other side, is patients call in asking for one thing, and then when they get into the office, there's 5 other things associated. And so perhaps the wrong visit type was matched. That's tough on a provider's side. We don't want to discredit what the patient needed in that day, but also they have a stack of patients who we knew that they were going to be a longer patient because they're an ER follow-up or what have you, right? And so it's up to the provider, instead of recognizing you're trying to chop, speed it up, you say, I see you came to me today to discuss this. Why don't you come see me next week so we can discuss how you're managing your diabetes or whatever the case may be, so that we can have a more thorough discussion, and then I could really see about trying to get some other members of my care team involved. That all still exists outside of it. We could probably still get a member of the care team involved. However, it provides additional time and resource to that patient and say, this isn't what you came to see me for. It's a point of education, but it didn't seem as off-putting. And so that way the patient really can get what they need. And then it also teaches them to articulate all the things you really wanted to address today. It wasn't just your cough. And so that gets really difficult for the providers to manage, because they're in the back of their heads. They're thinking, oh my gosh, this is the only kind of visit I got with you today. And I have 4 of these other longer ones because they were scheduled appropriately, because those patients said exactly what they wanted to come in for, not plus. I think the other piece of that is the provider manages those expectations for those patients. And so sometimes patients are medically complex and they require a more medically complex visit. And so letting them know it's okay to tell a patient, you're medically complex, you have a handful of chronic conditions, this is going to require the team. So you're not always going to see me. I work really closely with this clinical pharmacist, and they're going to help me manage some components of your care. And so using that language so it doesn't necessarily feel as rush, as chop, because it's difficult.
Yeah, and then I think that comes off as they still care about you and your care, and, that they want to give it the time that it deserves.
Correct.
And jumping back to our original, with the CAHPS scores and all these surveys being the perception that the patient has of their experience, do you think that there's anything that the health center could maybe do proactively before a visit to kind of prep the patient and set those expectations? Do you think there's like an outreach call, or do you guys do anything like that?
So we've seen pretty good success, at least with our annual wellness visits, because a lot of times our team will try to call and run through those questionnaires. And so I think anytime you know that you need a questionnaire, all of that prep work is very valuable. And then in that you say, I just want to run through these questionnaires so the provider has time to review prior to your visit. Because it's true, right? Then they're going to scan, they're going to find all the things they need, and they truly can prepare. But if you're not doing that till you get there, it's really tough for them to prepare for those. It takes humans, though. Like, of course, we have the ability to send them digitally, but someone sometimes still has to say, hey, we're sending this to you. We really need you to do this ahead of your visit so that your provider can prepare for your visit. And so it's still educating that patient and still using the human, which is okay. The more we do that, the better off our patients and their care is going to be.
Excellent. Excellent conversation about optimizing provider and staff behavior. Thank you so much.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.